Okay, my name's Alex Shilkoff. I'm a commissioning officer for Sheffield City Council, and the part of the Better Care Fund I'm working on is called Keeping People Well in the Community.
Can you give us a bit of background to the project?
Certainly. So it's really about trying to find people when they might be having a wobble and hopefully preventing them having a crisis, or even finding people before that wobble and making sure that they know how to look after themselves best. So the ultimate aim of what we're doing is to try and maintain people's health and quality of life so that they don't need to access acute health and social care services, but also if someone does need to, say, have an operation or a stay in hospital, that actually they've got the right support in place at home so they can go back home from hospital quickly and not be kept there for a long time.
So what exactly are you doing?
So over the last couple of years we've been doing a lot of work with local people and also different providers from the statutory sector, the voluntary community and faith sector and housing. And what that's meant is we've done certain trials and demonstration projects around looking at how we can work better in each area to make best use of the assets in that area. So for example, we were working in an area of Sheffield called Low Edges, Bakemore, Jordanthorpe, and in that area we made a priority, how do we keep people safe over winter, particularly older people who tell us that they struggle to keep themselves safe and well over winter because life for all of us is of course more challenging in severe weather. So we worked there with district nurses, GP practices, the public health team, some fantastic community organisations that are run through the churches, and local people to identify people who needed a little bit of extra help and also have something in place to help them. And from that work, what we found was that actually lots of connections were made between different sets of people who all have an interest in keeping people well in their community. So for example, district nurses are always in people's homes and picking up on housing difficulties they might have, but hadn't previously had a connection with the council's housing department. So now we've got that link and working relationship, and that's just a really small example of how in the city we really want to make the best use of all the resources that we've got so that people aren't working in isolation. So it's partly about identifying people at risk, but also about making best use of everything that we have in a community to keep people safe. Going forward now, from experience in the city of all sorts of work that's gone on in previous years, and also national evidence around prevention and what helps to keep people well and healthy, we've drafted an outcomes framework, and we're going to be working with providers and people of Sheffield to develop that framework further to make sure that the outcomes that we're working towards are the right ones, and then we're currently identifying any possible funding from the Better Care Fund and also other sources of funding that could fund some of that prevention work. So there's been lots of work done in the city around prevention and keeping people well, but one of the key differences in the future work is developing something called a risk stratification, and that's just a fancy term really that means identifying people at risk of declining health and well-being. So currently we have quite a accurate health-based model, but we want to combine that with other information so that we can feel confident that all the good things that we have in our communities around social activities, hobby and interest groups, health champions, expert patient programmes, district nurses, GPs, housing providers, that all the things they can do to help people stay well are targeted at the people that need that help the most. And for me that's really important, because we don't just want to help people when they're in an emergency or a crisis, even though of course those things are important. We want to help people enjoy a really good standard of life and quality of life for as long as possible in the community. So we need to identify who the people are that might need a little bit of help early to enable them to do that, and make sure all of us know how to keep ourselves safe and well.
So the people listening to this video, how can they be involved?
Okay, so in July there's going to be 4 events for any provider who does anything at all to do with keeping people well in the community. So that could be a GP, it could also be a lunch club, it could be a faith group, it could be a hobby and interest group, it could be a group that meets in a library, a group that does trips out, absolutely anything that helps people to stay safe and well. People should be being contacted either through the Health and Wellbeing Board's network or through your local area partnership network. And please do come to one of those events and contribute. We've initially said 4 events, but if they're really oversubscribed, we'll do extra events to make sure that everybody can come and contribute to that. And we'll be using those workshops to test our outcomes framework and see what people think about that, but also to help other providers meet each other and find out where they could be working together anyway. Also, over the summer, the dates haven't been given yet, but there will be some events for the public to attend as well, to make sure that where we've used public feedback to establish what ingredients we need in each neighbourhood to keep people safe and well, that we've got that right and that people still have a chance to contribute to that. So again, details of that should be coming out through the Health and Wellbeing Board, the local area partnerships, and also public information points, local newsletters, social media. So people should be able to find out about those and contribute to those if they wish to.
Thanks, Alex, for talking to us. Bye.
Thank you. Bye.